So this week, some of you will be able to go back to the races. We're not entirely sure at which courses at the moment, but we know, for example, that on Wednesday there will be 500 or 600 people at Ludlow Racecourse, maybe a similar number at Lingfield, Haydock, Kempton, potentially as well. And then moving through as the government gradually relax lockdown regulations and we move back into the tiered system. There are no racecourses in England anyway that are in Tier 1 at the moment. They are all in either Tiers 2 or 3. You can't have crowds back in Tier 3, and we await news from the Welsh Assembly and from the government in Scotland as well. Dr. Jerry Hill's the Chief Medical Advisor to the British Horse Racing Authority. Dr. Hill has been the busiest man in the sport for the last 6 months, and I've been trying to arrange an audience for some time. But Dr. Hill, I'm really pleased that we've made contact. Thanks very much for talking to me this morning.
Nick, good morning. It's a pleasure to talk to you, and I'm sorry I've been so slow in getting to you. As you say, it's been moderately busy over the last few months.
Just before we get into the nitty-gritty, what has it been like from a personal perspective? Because in your entire career as a doctor and a medical advisor and someone who's been closely involved with sport, you can't have ever encountered anything as politically complex as this.
No, it's been an extraordinary time, and you're right, something I was never anticipating or indeed prepared for. But I think for me what's been extraordinary has been the coming together within racing of different stakeholders and across sport. There's been this cooperation that I think has probably been unique in sport and possibly in racing as well. And I've had the opportunity to talk to stakeholders that I would never spoken to before, and to be fair, I've spoken probably to more people in the BHA than I've ever spoken to before as well. So I think we've very much had a common aim, and we've worked very hard together to deliver. And, you know, to be one of the first sports back on the 1st of June was extraordinary. Unfortunately, I think greyhound racing beat us to it by a few hours, but nonetheless, you know, it's been a very, very challenging and fulfilling time. But I'm often minded when I think about, you know, the many hours that lots of us put into. That's really small beer compared to my colleagues who are working in the hospital sector, who are going into emergency departments, going into ITUs, working on respiratory units day in, day out. So yes, it's been very busy, it's been very hard, but sometimes you need to take these things in context.
And has that informed the way you've personally dealt with it? So if there was ever a temptation to be a bit more gung-ho, has that experience with colleagues, has that past experience informed the way you go about this?
Yeah, undoubtedly. So early conversations with colleagues when we were looking to recommend the suspension of racing was very much taking into account their accounts of workloads in intensive care units around the country, and they've continued to feed that information into me. So we have around about 200 doctors who work on race courses around the country. So that gives me a very broad base of information to appreciate what's going on in the hospital sector. And you'll recollect, Nick, one of the main drivers early on about suspending racing and across sport generally was to not add to the burden of the NHS. And I think that was very much the right and proper thing to do. And throughout this whole crisis, I think we all have to think about what is the right thing to do. Not the thing we're allowed to do, not the thing we can get away with, but the right thing we can do. So we can look back and say, I did my best at the time. So I think that's been very informative. The other thing we can't lose sight of, and I know it's absolutely fantastic we're getting spectators back, albeit in small numbers next week, you know, we are not through this crisis. You know, without being gloomy, you know, we've had nearly 500 deaths yesterday. We've got approximately 15,000 new cases yesterday. We are not out of the woods. So I think it's really important that we continue to appreciate that we must continue, as I say, to do the right thing.
When you put it that starkly, it actually makes you pretty amazed that we've been able to race since June the 1st. What would you identify as the key reasons why the sport has been able to continue in a biosecure fashion, relatively speaking?
I think there've probably been two things. I think one is the very nature of the sport, and that was something which was recognised by Public Health and DCMS early on. So we are we're an outside sport, we're a rural sport, and we have space. And we know in COVID, space is protection. And that's why we've been able to run our protocols in a certain fashion, which has been different to colleagues in other sports, in indoor sports or in enclosed sports or contact sports. And so racing had that advantage from the word go. I think the other side of it is that racing is used to regulation. So actually having protocols to follow and realising there are consequences of not following those protocols probably was a bit more familiar in racing than perhaps it was in other sports. And I think those two things and that desire to actually do the right thing and come together. And of course, we do have the advantage that looking after animals, so the equine welfare side of things gave us also an advantage as well. But it's space. I think space has probably been our main strength here.
One of the key decisions early on was not to simply try and test every participant who is in that zone where the people who are essential workers on the racecourse are. Do you think that was a key decision at the time, and do you think it's impacted on your ability to continue?
I think it was a key decision, and certainly early on I was very much in the testing camp, and the original plans when the first iteration when we were going to run biosecure race courses and get attendees in for a week or two at a time and run them from very few number of sites, testing at that point seemed to be the right thing to do. But to be fair, it was points raised by owners and trainers who made me begin to think, actually, do we need to do that? Do we get value out of it? And I don't mean value necessarily about the financial side, although clearly would be a huge burden on racing if we'd had to test every attendee every time they attended at 150, 100 or so pounds each time. But were we going to get value? Was it going to actually make a difference to what we needed to do? And I think if we come back to the concept that we had the opportunity to space people out, people who were generally at the time coming from low risk areas of the country, was it going to be worth the return? And I think on reflection, I think it was the right decision not to go for a testing model with the testing modalities which were available at the time. And of course, these are now changing. So we may at some point review that. But at the moment, the very fact that we've had no proven transmissions on a racecourse on a race day, that's not to say we haven't had any in the industry at all, but no transmissions in those situations means that I think we can probably say, yes, it probably was the right decision because it was backed up by the other protocols which were in place.
And Dr. Hill, I think that Nick and I have been making the analogy of sort of snakes and ladders, or dabbing on the accelerator and then hitting the brake. I think probably most people were surprised maybe on the build-up to the run-up to Christmas that racecourses are going to be able to run as many events, if you like, off the back of just 2 trial events which seem to have been kicked into the new year. If you could tell people what your main concerns are for those who are potentially thinking of attending and what would help that model continue to flourish, what would they be?
So it's coming back, and I'm sorry, it's repeat messaging, and there's a danger of sounding like a broken record by saying the same thing over and over again, which clearly I'm now going to do. But it's those behaviours which have frankly been drilled into us, which are so important. They get a bit boring after a while because people think, oh, it doesn't really apply to me, or I'm only going to do such and such for a brief period of time. But it's there are some very simple messages we need to get across here. So I think first thing to do is that if you are not 100% well, please do not come to a racecourse. You need to stop and think, have what I got, could it possibly be COVID? Seek advice from your medical advisors, not me, but the NHS 111, 119, and then get a test if that's relevant. So that's the most important thing. Stay away if you're not 100% well. And certainly that's a message we've been pushing to the essential staff in the green zone whilst we've had racing behind closed doors. So that's number one. I think the next thing we need to think about is that we know that race courses, and to be fair, most sporting venues are safe places. They're controlled, they've got good protocols in place. You'll have people there reminding you to do things that perhaps you've forgotten to do. I think the vulnerability is that journey. It's the journey from your home to the sporting venue. So what I'll ask you to do is to think very carefully about how you make that journey, how are you going to travel, and who you're going to travel with. So the important thing there is we know that if you travel with members of your household bubble in private transport, that's going to be a really safe journey for you. And again, racing, that works great for racing because often in rural locations, there's usually parking. So avoid the coach, avoid the train if you possibly can, and travel safely. And then, okay, so that's the journey. But what happens when you get there? Well, we come back to those old chestnuts, social distancing, take advantage of the hand hygiene points around the place. We strongly encourage people to wear masks. In fact, now in green zone, we mandate that masks should be worn because it's a low cost intervention which has potential good benefits. So it's doing the right thing. All racecourses will have the QR codes for the app, the NHS app, that you can scan on arrival. And so I would urge people to download the NHS app because it gives us another layer, an opportunity to track people, because people are not very good at judging distance, and the app will do that for you, and it will tell you whether you've been close to someone or not. And so if you do get an alert, then you can do the right thing once again. And then, of course, coming full circle is that if you've been to a race day venue or indeed at any other time, and if you start to feel unwell, seek that advice, get the tests done in order that we can make sure that if there are any attendees at a racecourse who develop COVID, that we can help with the contact tracing side of things.
I think all of that's really interesting and something we're familiar with. The other thing I'd say was I was at Warwick for the trial that was done there, Doncaster as well. But the Warwick thing, that I was actually be able to observe at close hand people returning. And I know you mentioned the terrific impact on the National Health Service, etc. But I was taken by an older profile, if you like, who are people who were so pleased to be back sharing a common interest and how important it was for their well-being to be able to get out and socialise, albeit with those restrictions. And I think that's something that hopefully we will see a lot of this week, and that's also to be put into the equation, if you like.
Oh, I agree. I think, clearly I see all of this through a health lens. And of course, the initial focus, that health lens, is COVID, COVID, COVID. But we need to take a step back sometimes and look at health in a much broader sense. And that will include economic health, so that's the health of the industry, but also the benefit people get by socialising, albeit from a distance, coming out to participate, to watch a sport that they love. That has huge benefits. They're difficult to measure. It's not as clear as measuring a case of COVID, but it's clearly that as there is benefit to that. And what we're aiming to do is to deliver that benefit without exposing people to risk.
Have you been taken by surprise by news that crowds will come back this week, or have you been sufficiently on the inside that it didn't come as a surprise to you?
I've learned over the years it's better to be honest, Nick. So I have to be frank with you. It was sooner than I expected, and certainly we have across the various groups that I sit on been working steadily towards producing protocols and packages so that crowds could come back. And so we were prepared, but we probably didn't expect it on this timescale. And I think what we really need now to do with the government is to understand how we progress from here, because a few thousand people on the racecourse, it's a low risk activity. I'm sure we can manage that from a COVID point of view, but from a racecourse perspective and thereby extension the industry perspective, it's not really, I understand, an economically viable model. So where do we go from here? How do we progress? So that work is still going on in the background with DCMS, and I have to say that DCMS have been extraordinarily supportive of sport and have worked very well with us in racing as well. So, yeah, we need to know what the roadmap is going forward. And I think what we have to do as sports is to present that roadmap to government and assist them in that progress, because they have such a responsibility and so many people demanding of their time. Sometimes we need to present them with solutions and not just say, what can you help us with?
Where do we need to get to as a country in order to enable, say, a full crowd situation?
That's a good question. Well, I think there's been lots of talk about the vaccine, and I think we need to really be at a stage where we have significant uptake of vaccine in order that we can say that we can now protect people. Because if we're going to a full crowd, delivering a full crowd, even in the wide open spaces of racecourses, is going to be challenging with social distancing. So I think we need significant numbers of the population vaccinated so that they are safer. So if they do breach social distancing, it's less of a challenge. So I think that's probably going to be the game changer. And of course, whilst there's lots of talks about vaccines, they've not been launched as yet. They're still be going through approval with the MHRA. So there's a way to go yet. The other thing, of course, which is coming in is the near-patient testing, so the lateral flow tests, which were trialled in Liverpool. And I think we need to see whether or not that will allow us to expand the numbers of individuals at sporting venues. It's not just racing, but sporting venues, and indeed other entertainment venues at all as well. So I think the lateral flow tests and vaccination are going to be the two things which will accelerate the process, but I don't have a precise timescale for that.
Are any of those solutions potentially going to allow closer proximity for jockeys in weighing rooms? Because I think it'll be a shock for people. Nick and I are used to going on racecourses. You've been on plenty yourself, to see that weighing rooms are now in bars. They're in marquees behind where they were. And so even though racecourses have significant space, a lot of that space originally was designated to the green code, the green zone, making it COVID safe. There's not quite the flexibility in the remainder of the space whilst weighing rooms, etc., can't be used. Is there any way that that can be addressed earlier to enable more space, if you like, for the general population?
I think that's a really good suggestion, and it's certainly something that I would be interested in looking at. And you're right. I think the racecourses have done extraordinary work in reconfiguring their buildings, and they've worked so hard, and they were given a very short brief, and they've taken up the baton and run with it, and they have produced facilities for jockeys and other staff which are extraordinary, and that space will be sorely missed, I think, when we get back to a bit more of a normality. And it may well be, if we are bringing people close together, testing might be an option in order to facilitate that.
Dr. Jerry Hill, thank you so much for talking to me this morning, and best of luck for the next few weeks. If you want to leave us with one closing message, what would it be?
I think it's do the right thing. I think you have to understand that we all have a responsibility to look after ourselves and the people around us. It's not something that you can be policed or regulated into. I think you must, as an individual, take that responsibility and do the right thing and follow the simple advice which has been given.
Thanks so much.